we are back. Welcome to the Vision Care Hearing Solutions podcast series. Today again we have Dr. Maureen with us and Ms. Chatira as well. So, we're going to talk about a very important topic today. Like, usually many of us, we get our blood sugar checked, we worry about our sugar levels, we worry about our cholesterol levels, and one thing uh, which we rely on every single day, one sense that we rely on every single day, that we rarely think about checking is hearing,
Yeah.
which is one of the very most important senses. Okay, so and what I think, like, because the hearing loss, it develops very gradually, very slowly. People don't even realize it. Okay, so but the cost of waiting. So yeah, today we are going to talk about the cost of waiting when it comes to hearing health. Okay. So what do you think? How common is hearing loss?
It's more common than people think, and it's not just older people. We all are going to get older, and almost everyone who gets older will have some hearing loss. But of course, there are people who are born with it, especially as young when they're children. You can get it from loud noise exposure, but we know about 20% of people in the world have hearing loss. So it's a high percentage of people, especially since can have such a big impact on their lives. And again, most of the people will not acquire the hearing loss until they're a little bit older, but that could be 50 or 60 years old, depending on their exposure to noise and other health things can also affect your hearing loss.
Yeah, the hearing goes unnoticed, like especially in the early stages. Like they
Yeah.
don't really notice. Why do you think the reason is?
Well, when we think about our vision, it's very clear when you can't see something clearly and sharply. You can really tell, your friends can tell, you can't read things as well. But with our hearing, because it typically happens gradually, you're not noticing it so much. And maybe you think, oh, everyone mumbles, or, oh, yeah, it's so noisy there, I can't hear. No one can hear in that place. So it's easy to make an excuse because we haven't had the evaluation to find out, is it something that I should be thinking about? Or is it something that's, like maybe there are restaurants you go to that are very noisy, or sporting events that you really can't hear like your friends. But these situations where it's a little bit noisier makes it much harder to understand clearly with even a mild hearing loss. Same thing with just talking with your friends and family, missing out on things. And you think, oh, they just mumble.
I know it's so. I think it's one of the most common things that we hear from patients.
Yes.
The complaint mostly come from the family members rather than the patient themselves.
Yes.
And most often we hear the wife say, "He just doesn't hear my voice."
Right. Selective hearing.
Selective hearing. Yeah, no, she doesn't talk loud enough or not clear enough. So I think we tend to put it outside rather than, be a bit reflective on it and say, oh, something possibly could be wrong with me, which is human nature, I would
Right.
say.
And, like you said, when families think of selective hearing, there's certain situations like talking now one-on-one in a quiet place.
Yeah.
People with even a mild hearing loss typically can do fine and they can fill in a little bit of the blanks. But when you get into noisier places or your hearing gets a little bit worse, or there's some, like I said, other noise around you, or lots of people talking, that's when it becomes really difficult and you have to work so much harder. And what happens is when you're working really hard, your brain's working hard. And sometimes you just kind of give up, like, I'm not getting this, and then you start to isolate yourself. So then it becomes even more of a serious issue because isolation can really lead to some mental health concerns, some depression, and not being involved.
Yeah.
And why do you think they're reluctant to seek medical help?
Well, I think a lot of it, people do often think of hearing loss as something that happens to people as they get older. No one likes to admit things that are happening as you get older. Well, your knees get a little tough, or your vision a little bit. But the aging thing is a big concern for many people. They don't want to be thinking of themselves as getting older, or thinking or saying, well, oh yeah, my hearing's going because I'm getting older.
Yes, normalize it, right?
And I mean, I don't like going to the dentist unless my toothache gets really bad.
Right.
So it's something that we think that we can put off or do it on a later day. I think that's quite relatable when, you know,
And it's a
About the
test.
keep
You know,
pushing.
people think it's a test. I mean, who wants to get tested? You know, and then you think if I get tested, now I have to do something.
yeah,
Ooh, that's the next step. You
yeah,
know, we have to accept it and not deny it and then move on. Because certainly we have so much ability, technology that can benefit people very easily to make such a big difference in their life, but they just don't know it yet.
Okay, so when they decide to come to you, like,
Mhm.
what do you think the turning point is?
You know, a lot of the turning point, as you mentioned, is family. You know, if it's an adult who's older, maybe only has their kids with them, their adult kids, they often come in and say, you know, we're really concerned about you. We want to make sure that you're participating. You can hear the grandkids, you know, being able to do the things that you used to do or go to the places you used to. So it's your family. Sometimes it may be your job. It's very concerning when when you think your job may be affected, because that's your livelihood, right? If you're still working, because certainly people in their 40s and 50s can have hearing loss that can even still be mild, but affect how you perform in a meeting, how well you respond when someone asks you a question. If you give an answer that's like they're thinking, what are they thinking? You know, so you don't want to be looking like you're not able to follow along. So it's usually your friends and family. Sometimes the doctor will tell you, but and often the doctor has, you know, very good advice, and people will listen to the doctor.
yeah.
They say, oh, the doctor says I should do this. Let me go do that. But they don't often mention it to the doctor.
Yeah.
Yeah.
I think the reasons differ, at, like as Maureen mentioned, at which stage of your life you are in.
Mhm.
Like if you're a professional, if you're young, if you're working, communication needs are, I guess the demands are more.
Mhm.
And then I think in Sri Lanka, what we notice is if you're retired and you feel that your senses are failing and you think that, okay, this is a part of aging and I should just accept it.
Mhm.
And you might be saying yes to a whole bunch of other problems without knowing, you know, what, like missing out on your family, communication, and how that affects your brain. So you might not be knowing what you're saying no to right now, but it could have detrimental effects when it, you know, down the
Yeah, that's a
line.
really good point you said about
Yeah.
how it affects your brain.
Yeah.
Because when your hearing isn't good, you're having to work harder and you're using what we call cognitive resources. And you know, also we know that the brain can change. We see that through brain imaging, that even with a mild hearing loss, the part of the brain that works for your hearing can change and stop working as well. But if we also know from studies that once people get amplification, that the better part of your hearing, we don't make your hearing normal again, but the part of your brain can restore back to the way it was functioning better. So
Thank
it's
you
really
very
important.
much for that, Maureen, because people with mild hearing losses,
Yes.
it's very difficult to convince them.
Mm.
And the question that they ask is, can I stay without a hearing aid couple of more years? So,
And what might you be missing out on? I mean, why work so hard? You know, when you're going to a place that's a little bit noisier, you really have to lean in. Maybe you're missing things, you're missing the jokes. You know, it's not as much fun. You don't go to the favorite restaurants as much or noisy places. So, I mean, think about what you might be missing in the next few years. Also, you know, younger children have their little soft voices and they always want to be around. And if you miss those voices, you know, those are so precious. So there's a lot to be missing. But we also know that your brain health is so important. And all the things that can affect your brain health, like I said, isolation, also falling. People who don't hear well have a higher rate of falls. And that's really important too for your health.
I don't think a lot of people know that is related to
Mhm.
accidents, balance issues.
And then you think about too, also safety and security. When you're walking on the street, you really need to hear well all around you. Not just the horn honks are easy to hear, but when people coming up behind you or talking or other kinds of sounds that you need to be catching for your own safety, it's really important to hear well all around you.
yeah, another question from professional point of view. What do you think like that when people delay the decision to go for hearing aids and say it's just a mild hearing loss, but what's the impact on the outcome of hearing it. Like say, like
Good point.
as audiologists, we always get this problem because the hearing loss is mild, but the discrimination is, oh my god,
Right.
and it's very difficult to like they say that I can hear you talking, it's just
Right.
the clarity, but oh my god, even with the very high technology, it's very difficult to get that clarity back, and the responsibility falls on us, right?
Actually, it reminds me of some of my older patients would tell me getting used to hearing aids for some of them was like getting used to dentures, because if you put it off for a
Let's
long
talk about that.
time, there's sounds you've been missing for so long that now you're hearing the world is like a lot noisier than you remember, because now you're hearing so much better, but you've been living in this quieter world. Some people adjust to dentures easily, and some people are always fighting it. It's just that they're never
Yeah.
loving it, of course. But the sooner that you can start, just like with wearing glasses, the sooner that you start, the easier it is on your brain to adjust.
used to
And it's a lot quicker, your adjustment, than to hearing the sounds around you well again than if you wait a longer period of time.
Yeah.
And now it's like, wow, it's almost a little bit overwhelming for some people that there's so much sound out there that they missed.
Yeah, have you met people who say that I should have gone for this earlier?
Yeah, it's a regret. I mean, it's so bad that they realize it so far down the line that there's no coming back from it. Like the sound quality that we could have given them if
Right.
it was identified earlier on
Right.
would be so different. It's I think it's not their fault, right? It's just the lack of awareness and the lack of importance, I would say, that we give to hearing overall in
Yeah.
general.
That's a really good point. And the whole, again, the way your brain works, it's kind of like the use it or lose it. If you're not hearing, if you're not getting the input to your brain to hearing well and getting sounds stimulating your brain, then when you are hearing them later, finally with hearing aids, it takes a lot longer time to get used to it and to adapt. So we really want to make that easier for the patient so that they can go on and enjoy their life. I mean, to not have to stop doing things or stop participating and maybe start withdrawing socially, which can be very detrimental overall to your health.
Exactly. So, like, with the hearing aid, what impact can we make?
Tremendous, tremendous. I mean, when you said, people think, do they sometimes regret, if they once they realize how well they're hearing, they'll often say, why did I wait so long? I didn't know how easy that was going to be to hear so much better, so much more clearly, and that the hearing aids are easy to wear and comfortable. They may have old ideas about maybe how their parents or grandparents miss about it.
Yeah,
Yeah.
a lot of it
Right.
actually.
Yeah.
More than any other device, medical equipment, I would say there are a lot of myths that we need to demystify.
That's true.
Hearing aids.
Exactly. Like if you're supposed to go for a stand or anything, you would go right away, right? But hearing it, oh my god.
Yeah,
So
people do put it off, and and it's a personal thing, but often you want to be able to go when you can certainly start getting benefit, and when your family, but you don't want your family nagging you. That's
Yeah.
tough.
We never want the patient
No.
to be pushed or forced to wear it because at the end
Exactly.
of the day, it is the patient who wears it.
Yes.
But something that I tell my patients is that you're not wearing the hearing aids for yourself, you're wearing it for your family and for your loved ones.
Yeah.
As a starting point, at least. Yeah. And I think that hearing, we do it in so many ways. Like we do it with our eyes. We gather what the other person says with their gestures, with their facial expressions. So people can manage for a really long time without any help, but using other senses. And
Yeah.
I think,
Working a lot harder.
yeah, we're working a lot harder
Yeah.
using, other parts of the brain. Like it blew me away to see those images, the CT scans that they did, how other areas of the brains light up
Yeah.
when you hear, right? And how your brain reorganizes.
Yes.
So it's just
the cost. What is the cost?
the cost.
I mean, the cost is a lot. I mean, if you're still working, very much so, it can certainly affect your livelihood or how well you can do your job. But of course, again, most people with hearing loss will say the most important thing for them is to enjoy their family and friends.
Yeah, the
And you know,
relationships.
yeah, the relationships and kids and celebrations. I mean, things that you want to participate in that really makes a big difference. And the cost of not is that you can't get those memories back.
And
You know?
Helen Keller says, like, blindness separates us from things,
Mhm.
but hearing loss separates us from people.
People. Mhm.
Exactly.
Yeah, it's the connections,
Mhm.
relationships.
Yes.
Yeah.
Yeah. So shall we talk about a little about like auditory deprivation? Because like most of the people are not aware of it. So they actually like one of the reason is they don't actually know like they think that at any point of life if they go for a hearing aid they can perform equally as well, like
Yeah.
so
I mean, as your hearing changes, like you mentioned also, your understanding for words can decrease as well. And your brain needs that constant stimulation. That's how it normally works. But without the stimulation, then parts of your brain don't pay attention to sounds anymore. Now they look in, get reorganized into vision,
Yeah.
But we do know from
crazy.
with hearing aid studies is that when people do start wearing hearing aids, we can regain that. Also, we do know that there's a correlation and a lot of discussion in the medical field right now about the effect of cognitive decline. How when you're having to work so hard and as you're getting a little bit older, things do get harder to do. But if your hearing is also affected, then your brain is working harder and it's not using its resources as well. So that's why we have falls, we have people getting isolated. So we want to reduce the potential for cognitive decline as people get older by helping them stay engaged. And participating as they had been earlier. So that's a big new focus in the medical field about how can we reduce cognitive decline as people are getting older, because we know it happens generally, but by participating and being able to hear better, you can participate and help to reduce that, because it's one of the few things that we can actually do ourselves to make a difference as we get older. If we decide that we have hearing loss and hearing needs, by getting amplification and getting it sooner than later, then we're also making it easier on our brain to continue to work as well as possible so we can reduce the effect of cognitive decline as we get older.
Yeah, why I actually brought up this is that people come to us like finally decide to go for the hearing aid and then later on come to us and say that okay, people are asking me why I'm still asking for repetitions while wearing hearing aids. Okay, they don't ever talk about the delay that happened. So that's like in my clinical experience, like if you wait for more than 10 years to go for a hearing aid, it's very difficult to get that same outcome, the same benefit from the hearing aid. Like they still struggle to hear clearly in noisy environments. So this wait has a cost. This weight has a huge impact on your quality of life, the hearing aid outcome. So yeah, we must actually emphasize the early intervention, right?
Right, because the brain has to get retrained. I mean, for all those years of not getting the auditory input that it normally craves and uses to focus and help us filter out sounds we don't want to hear, it hasn't been getting that information. So we kind of lose some of that benefit, that function of the brain. So it is very important to start earlier. Again, because your hearing is not as severe, it's much easier to stay and get back into life rather than now you have to learn so much more.
When you say like cognitive decline, that's a huge, like, cognition involves memory, like different functions. A lot of people take the decision because they're scared of dementia or Alzheimer's disease, because there have been studies that correlate hearing loss and the two. Would it be correct to say that hearing loss causes dementia or Alzheimer's?
Absolutely not.
Yeah.
We don't have that, and there's been a lot of studies, and there still are. We don't have the definitive information. There's been a lot of studies looking at people who've been treated with hearing aids, and a group that wasn't treated with hearing aids. But the group that was with hearing aids, they were still active and healthy, whereas the other group, because they weren't wearing hearing aids, they weren't as healthy or as active normally. So we do see the relationship, but we cannot say, and we should never say, that hearing loss causes dementia. We can't say that, but we do know that we can, by helping to reduce our cognitive decline or slow it down by staying engaged. And the only way to be able, the best way to stay engaged is to be able to hear your friends and family. And so you're participating. Yes, that communication, that's all that connections. So by making that change earlier on in your life, then the rest of your life will also be more fulfilling. So it's all about quality of life.
Yeah, that's exactly true. So, like today, we talked about a very important thing, very, very important thing about your hearing health. So, we'll meet up again with another topic. Okay, so we think that from this discussion, you got something really, really valuable, and we'll take step as soon as possible if you notice something wrong with your hearing.
Yeah, the testing is easy. And especially the
Hardly
professionals at your office, so easy to do that. And then make your decision, move forward.
Yeah. Don't let your imagination or your fears get the best of
Or
you,
your
I would
vanity,
say.
because we can make them so small now.
Yeah. It's just, I think knowing is half the battle. So just know what your body is trying to tell you. So
Exactly.
listen.
Okay, thank you so much.
Thank you.
Thank you.
Let's meet again. Bye bye.